Welcome to the official GlobalRPh YouTube channel. If you haven't already, be sure to hit that subscribe button so you never miss out on our latest videos. This video presents an extensive list of the top 20 contagious diseases in the United States, ranked by their prevalence and impact on public health. Each disease is briefly summarized, including its causes, symptoms, and transmission methods. Additionally, the risk each disease poses to the general public is assessed. This information aims to provide a clear understanding of the most significant infectious diseases affecting the U.S. population and their potential consequences. Contagious diseases continue to be a major concern for public health in the United States. Understanding the prevalence and impact of these diseases is crucial for developing effective prevention and control strategies. This video aims to provide an overview of the top 20 contagious diseases in the country, offering insights into their characteristics and the risks they present to the general public. Common cold. Summary. A viral infection of the upper respiratory tract caused by various viruses, most commonly rhinoviruses. Extremely high prevalence, with adults experiencing 2 to 3 colds per year on average. The impact is generally mild but can lead to dramatic productivity losses. The risk to the public is low, as it is usually self-limiting and rarely causes severe complications. It spreads through droplets in the air when an infected person coughs or sneezes, or by touching contaminated surfaces. Symptoms include runny nose, sore throat, cough, and mild fever. It can be prevented by washing hands frequently, avoiding touching one's face, and avoiding infected individuals. Influenza, flu. Influenza viruses cause a viral infection that affects the respiratory system. Seasonal outbreaks affect millions of people annually. Influenza can cause severe illness, hospitalizations, and deaths, especially in high-risk groups. The risk to the public is moderate to high, particularly during flu season and for vulnerable populations. It spreads through respiratory droplets when an infected person coughs, sneezes, or talks. Symptoms include fever, body aches, fatigue, cough, and headache. It can be prevented by getting an annual flu vaccine, washing hands often, and avoiding close contact with infected individuals. Treatment includes antiviral medications that can help reduce the severity and duration of flu symptoms. COVID-19. It's a respiratory illness caused by the SARS-CoV-2 virus. Since its emergence in 2019, it has affected millions of Americans. The impact has been profound, putting a considerable strain on healthcare systems, causing economic disruption, and sadly, leading to loss of life. The risk to the public is high because of its high transmissibility and potential for severe outcomes. Common symptoms include fever, cough, fatigue, and loss of taste or smell. How can it be prevented? Well, get vaccinated, wear masks in crowded areas, maintain social distance, and practice good hygiene. Various treatments are available, including antiviral medications and supportive care. Chlamydia. This is a sexually transmitted infection caused by the bacterium Chlamydia trachomatis. It's actually the most commonly reported bacterial STI in the United States. If left untreated, it can lead to serious reproductive health issues. The risk to the public is moderate, primarily affecting sexually active individuals. Gonorrhea. This is another sexually transmitted infection caused by the bacterium Neisseria gonorrhea. It's the second most commonly reported bacterial STI in the United States. If untreated, it can cause serious complications, including infertility. The risk to the public is moderate, mainly affecting sexually active individuals. Human papillomavirus, or HPV. It's a group of viruses that can cause various types of cancer and genital warts. It's very common, with most sexually active people contracting it at some point. HPV can lead to several types of cancer, including cervical cancer. The risk to the public is moderate to high, due to its high prevalence and potential for serious health outcomes. Herpes simplex virus, or HSV. This is a viral infection that causes oral and genital herpes. It's very common, affecting millions of Americans. HSV causes recurring outbreaks of sores and can have psychological effects. The risk to the public is moderate, mainly because of its high prevalence and lifelong nature. Norovirus. This is a highly contagious virus that causes gastroenteritis. It's pretty common, especially in crowded settings like cruise ships and nursing homes. Norovirus can cause severe dehydration, particularly in young children and older adults. The risk to the public is moderate due to its high transmissibility and potential for outbreaks. It spreads through contaminated food or water and contact with infected persons or surfaces. Symptoms include diarrhea, vomiting, nausea, and stomach pain. You should practice good hand hygiene, wash fruits and vegetables, and avoid preparing food when sick. Is there a treatment? There's no specific treatment, but staying hydrated is important. Strep throat. It's a bacterial infection caused by Group A Streptococcus. It's pretty common, especially among children and teenagers. If left untreated, it can lead to more serious complications. The risk to the public is low to moderate because it is treatable with antibiotics. It spreads through respiratory droplets and close contact with infected individuals. Symptoms include a sore throat, fever, and swollen lymph nodes. To prevent it, wash your hands frequently, avoid sharing personal items, and stay away from infected individuals. Pneumonia. This is an infection that inflames the air sacs in one or both lungs. It's quite common, especially among older adults and those with weakened immune systems. It can be life-threatening, particularly for vulnerable populations. The risk to the public is moderate to high, especially for at-risk groups. It can be caused by viruses, bacteria, or fungi. It can spread through respiratory droplets or by inhaling contaminated air particles. Symptoms include cough, fever, difficulty breathing, and chest pain. To prevent it, get vaccinated, practice good hygiene, and avoid smoking. Treatment depends on the cause and may include antibiotics, antivirals, or supportive care. Tuberculosis, or TB. It's a bacterial infection that primarily affects the lungs. The prevalence is relatively low in the United States, but it's still a concern in certain populations. It can be severe if left untreated and requires long-term treatment. The risk to the public is low to moderate thanks to effective control measures in place. TB is caused by Mycobacterium tuberculosis bacteria. It spreads through the air when an infected person coughs, sneezes, or talks. Symptoms include a persistent cough, weight loss, night sweats, and fatigue. To prevent it, get vaccinated, practice good hygiene, and avoid close contact with infected individuals. TB is treated with a combination of antibiotics over several months. Hepatitis B. It's a viral infection that attacks the liver. Thanks to vaccination efforts, its prevalence is relatively low in the United States. However, it can lead to chronic liver disease and even liver cancer. The risk to the public is low to moderate, mainly affecting specific risk groups. Hepatitis C. This is a viral infection that causes liver inflammation and damage. It affects millions of Americans, many of whom are unaware of their infection. It can lead to chronic liver disease, cirrhosis, and liver cancer. The risk to the public is moderate, given its often asymptomatic nature and potential for long-term health consequences. Chickenpox. It's a highly contagious viral infection caused by the varicella-zoster virus. Due to widespread vaccination, it is less common now. While generally mild in children, it can be severe in adults and immunocompromised individuals. The risk to the public is low to moderate, primarily for those who are unvaccinated. Measles, a highly contagious viral disease that causes fever and a characteristic skin rash. Its prevalence is low due to vaccination, but outbreaks still occur. Measles can lead to serious complications, including pneumonia and encephalitis. The risk to the public is moderate, especially in areas with low vaccination rates. Mumps, a viral infection that affects the salivary glands. Its prevalence is relatively low due to vaccination, but outbreaks can occur. Mumps is usually mild, but can lead to complications such as meningitis. The risk to the public is low to moderate, mainly in areas with lower vaccination rates. Pertussis, also known as whooping cough. A highly contagious respiratory disease caused by the bacterium Bordetella pertussis. Its prevalence has seen a resurgence in recent years despite vaccination efforts. Pertussis can be severe, especially in infants and young children. The risk to the public is moderate, particularly for unvaccinated individuals and infants too young to be fully vaccinated. How does it spread? It spreads through respiratory droplets when an infected person coughs or sneezes. Symptoms include severe coughing fits, often with a whooping sound, and vomiting after coughing. Vaccination is the most effective prevention method. Antibiotics are used to treat whooping cough and prevent its spread. Methicillin-resistant Staphylococcus aureus, or MRSA for short. It's a type of staph bacteria that is resistant to certain antibiotics. It's pretty common in healthcare settings and, increasingly, in community settings as well. MRSA can cause serious skin infections and, in some cases, more severe invasive infections. The risk to the public is moderate, especially in healthcare environments and among at-risk populations. It spreads through direct contact with infected individuals or contaminated surfaces. Symptoms include skin infections, boils, and abscesses. How can it be prevented? Practice good hygiene, keep wounds covered, and avoid sharing personal items. MRSA can be treated with specific antibiotics chosen based on sensitivity testing. E. coli infection, a bacterial infection that can cause gastrointestinal illness. It's quite common and often associated with contaminated food or water. Usually the impact is mild, but it can be severe, especially in young children and older adults. The risk to the public is generally low to moderate, with occasional outbreaks linked to food contamination. E. coli is a type of bacteria found in the intestines of humans and animals. It spreads through contaminated food or water, or contact with infected individuals or animals. Symptoms include diarrhea, abdominal cramps, and sometimes fever. It can be prevented by practicing good food safety and hygiene, especially when handling raw meat. Most E. coli infections resolve on their own, but severe cases may require medical attention. Lyme disease, a bacterial infection transmitted by ticks. It's the most common vector-borne disease in the United States, particularly in certain regions. The impact can be dramatic, causing a wide range of symptoms and long-term health issues if left untreated. The risk to the public is moderate, especially in areas with high tick populations. Lyme disease is caused by the bacterium Borrelia burgdorferi. It's spread through the bite of infected black-legged ticks. Early symptoms include a bullseye rash, fever, chills, and body aches. And how can it be prevented? Use insect repellent, check for ticks after outdoor activities, and remove ticks promptly. Lyme disease is typically treated with antibiotics. Meningitis. Meningitis can be caused by viruses, bacteria, or fungi, It can spread through respiratory droplets or close contact with infected individuals. Symptoms include severe headache, stiff neck, fever, and confusion. Vaccination for some types, good hygiene, and avoiding close contact with infected individuals can prevent it. Treatment depends on the cause and may include antibiotics or antiviral medications. Conjunctivitis, also known as pink eye. Pink eye can be caused by viruses, bacteria, or allergies. It spreads through direct contact with infected individuals or contaminated surfaces. Symptoms include redness, itching, and discharge from the eye. Practice good hygiene, avoid touching or rubbing eyes, and don't share personal items. Treatment depends on the cause and may include antibiotic eye drops or ointments. Next, we will look at hepatitis A. It is caused by the hepatitis A virus. It spreads through contaminated food or water or close contact with infected individuals. Symptoms include fatigue, nausea, abdominal pain, and jaundice. Get vaccinated, practice good hygiene, and avoid contaminated food and water. There's no specific treatment, but supportive care is provided to manage symptoms. What is rotavirus? Rotavirus is a virus that causes severe diarrhea in young children. It spreads through the fecal-oral route, often through contaminated hands or objects. Symptoms include severe diarrhea, vomiting, fever, and abdominal pain. Vaccination and good hygiene practices are the best prevention methods. Treatment focuses on preventing dehydration through fluid replacement. Next, we will look at hand, foot, and mouth disease. It's usually caused by the Coxsackie virus A16 virus. It spreads through close contact, respiratory droplets, and contact with contaminated surfaces. Symptoms include fever, sore throat, and blisters on hands, feet, and mouth. Practice good hygiene and avoid close contact with infected individuals. There's no specific treatment, but symptom relief is provided. The list of top 20 contagious diseases in the United States highlights the diverse range of infectious agents that pose risks to public health. These diseases vary greatly in their prevalence, impact, and risk to the general public. Some diseases, such as the common cold and influenza, are highly prevalent and affect millions of Americans each year. While their impact on individuals is often mild to moderate, their widespread nature results in significant cumulative effects on public health and the economy. Other diseases, like COVID-19, have emerged as major public health threats, causing substantial morbidity, mortality, and societal disruption. The ongoing COVID-19 pandemic has highlighted the potential for new infectious diseases to rapidly spread and impact global health. Sexually transmitted infections, STIs, such as chlamydia, gonorrhea, and HPV, represent a substantial portion of the list, underscoring the importance of sexual health education and prevention efforts. Vaccine-preventable diseases like measles, mumps, and pertussis continue to pose risks, especially in areas with lower vaccination rates. This highlights the ongoing need for strong immunization programs and public education about vaccine safety and efficacy. Some diseases, such as tuberculosis and hepatitis B, have a relatively low prevalence in the United States due to effective public health measures, but there are considerable concerns globally. Antibiotic-resistant infections like MRSA represent a growing threat, highlighting the need for judicious use of antibiotics and development of new treatment strategies. Vector-borne diseases like Lyme disease remind us of the importance of environmental factors in disease transmission and the need for targeted prevention efforts in affected regions. Understanding the prevalence, impact, and risk of contagious diseases is crucial for effective public health planning and response. This list of the top 20 contagious diseases in the United States provides a snapshot of the current infectious disease landscape in the country. It highlights the need for continued vigilance, research, and public health efforts to prevent and control these diseases. By staying informed about these health threats, individuals and communities can take appropriate measures to protect themselves and reduce the spread of infectious diseases. Thank you for watching our GlobalRPh production. If you found it enjoyable and informative, please consider liking the video and subscribing to our brand new YouTube channel. Our content spans a wide range of topics designed to appeal to a diverse audience, ensuring there's always something fresh and engaging for everyone. Your support helps us grow and continue to provide interesting and valuable content. Stay tuned for more exciting videos.